Hey everyone, I'm Braden Jornby.
This is Johnny McCormick. This is exercise intervention and heart failure. So, physical activity is obviously extremely important, especially for patients who have suffered from heart failure. Regular exercise has been associated with a lot of improved quality of life for these patients, but unfortunately, there's recently been an epidemic of physical inactivity for these patients. It's known that chronic heart failure is common and extremely debilitating to patients who experience it. Once they experience heart failure, it's normal for their quality of life to constantly decrease. Heart failure may even lead to other physical and mental ailments, including depression.
So, the purpose of this proposed study was to determine how effective a social cognitive theory based exercise intervention was with people who had experienced heart failure previously. The primary objective of this study was to determine if this study led to improved levels of physical activity. It was hypothesized by the group conducting the study that the theory-based educational intervention would immensely improve level of physical activity among patients suffering from heart failure.
So, the methods that were used in this study, the participants were recruited obviously from among patients who have heart failure. All these participants were diagnosed with cardiovascular disease and then referred to cardiac rehabilitation in the Isfahan Cardiovascular Research Center by their cardiologists between the months of May and August in 2013. These patients also have to be over 30 years old. They have to be able to speak and read Persian, and they have to have a resting left ventricular ejection fraction of less than 40, as well as they need to be living with a family member who is willing to assist with this study. They ideally want to select 60 patients for this study.
So the methodology continued. This was a single-blind, randomized control trial that took place with the participants at a certain cardiac rehabilitation program. Participants are assigned to a social cognitive theory-based exercise intervention group or a usual care group that will function as the control group. Physical activity was measured by a translated version of the International Physical Activity Questionnaire, or IPAC. Patients' health-related quality of life was measured with the Minnesota Living with Heart Failure Questionnaire. Physical activity and health-related quality of life were the primary outcome measures of this study. The secondary outcome measures consist of cardiac exercise self-efficacy, outcome expectations for exercise, exercise self-regulation, social support for exercise, anxiety, depression, resting heart rate and blood pressure, exercise capacity, maximum heart rate, left ventricle ejection fraction, and body mass index.
So, more with the methodology, the physical activity intervention is based obviously on using guidelines of the social cognitive theory. The focuses of this intervention method are self efficacy, self regulation, social support, and outcome expectation. The patients will be randomized into an intervention group and a control group, as stated previously. The intervention group will receive 8 weekly face to face counseling sessions throughout a 2 month period, 6 educational intervention sessions in a focus group. They'll see video shows and receive book and pamphlet reviews, as well as short massage services. Patients in the intervention will be recommended a certain amount of exercise based on their baseline fitness levels. And if they meet or exceed their recommendations, they'll be given positive encouragement as well as motivation to aim for even more physical activity. But if they don't meet these recommended exercise baselines, they'll be only told to aim for just more physical activity.
So the main results, this was actually only a proposed study, so we don't have any results conducted, but we imagine that this study would have success as it's one of the first of its kind. The interventions proposed in this study can provide very efficient tools to change heart failure patients' behavior. When the study is conducted, if it shows improvement in physical activity behaviors among heart failure patients, there also may need to be future experimental work done in order to determine the most important aspect of the social cognitive theory-based intervention in the cardiac rehabilitation setting.
So the conclusion for the study that hasn't taken place, we're kind of just focusing on the limitations here, which there are actually a lot of. The first one involves the very small time period for which patients could be recruited. It was just that May of August of 2013. The intervention that consists of watching a movie will also be difficult, just trying to get all 60-ish of those patients together on the same day. It also may be tough for patients to adhere to a cardiac rehab program, resulting in a potential high attrition rate. Another limitation is the difficulty with prescribing a tailored exercise regimen to each individual patient. There are obvious limitations with any social cognitive theory based intervention study. Regardless of all of these, I think this study still has tremendous potential to be successful.
So one of our questions that we asked was, why is this one of the only heart failure intervention programs based on the social cognitive theory? As we stated, we think it could be very effective and helpful to patients due to its major components using social persuasion and learning experiences. And we decided our answer would be, we thought the main reason the study hasn't been completed or others like it is because of the amount of time and resources that would be needed to go through with this research. You would most likely need a good amount of trained and paid people to lead things like focus groups and counseling sessions, as well as the time it would take for all of the tests for each patient and measuring things such as anxiety, depression, heart rate and blood pressure, and exercise capacity and maximum heart rate.
So our final question was just, I guess, why the study had so many components when a lot of them realistically ended up being their predicted limitations. So I guess what would we change, or what did we think were too limiting that could be adjusted? So some of the components, like I said earlier, the 2-month time period, the family needing to be involved, and all the tests that were needed for this study were kind of limiting, even though it's only a proposed study. So things like these may be necessary in the experimenter's eyes, but we thought they could all be toned down just a little bit because of the amount of steps so far in this potential study that may push potential patients away. That's all we have. Hope you enjoyed. Thanks for watching.
Thanks.